Good morning, everybody. Welcome to Beat TV. It's such a pleasure to be here. I've got an extra special, phenomenal panel to share with you today. We're going to be talking about how women academic surgeons are functioning in the space, how they've maintained for as long as they have, and what tips and tricks they have for people coming up behind us in order to do successful things in this space. I've got a great panel here with Dr. Megan Tracci, Dr. Caitlin Hicks, and Dr. Jennifer Perri. Dr. Hicks and Dr. Tracci are vascular surgeons. Dr. Perri is a cardiothoracic surgeon. And we're going to have a wonderful day talking today about this. So let's kick it off with Dr. Tracci. So Dr. Tracci, tell us a bit about where you are in the academic space and how you got to where you are today.
Absolutely. I'm currently a vascular surgeon at the University of Virginia in Charlottesville. I've been there my whole career. I trained there in general and vascular surgery and have stayed on faculty. Where am I in this space? Academically, I'm a full professor of surgery there.
Wow, nice.
And how did I come to this? I was actually interested in health policy before I was interested in surgery, and attended the University of Illinois, where I did an MD-JD. And I've been active in the policy and advocacy space on behalf of vascular surgeons and institutionally throughout my career. How do you do this for so long? I think that we're all adaptable and versatile and tough. But I also think that there's an element of being adaptable and taking opportunities that become available to you when they become available to you, even though they might not completely line up with your interests or where you thought you were going to be. But then over time, you find a way to develop a niche for yourself, expertise that really aligns with your interests and your passion. And that in itself is sustaining. And I think really creates opportunities for you in the academic space as you distinguish yourself with your own expertise.
That's excellent. Let me piggyback off of that to ask you, Dr. Hicks. So, one of the things that Dr. Tracci just said was this idea of like grabbing those opportunities. And so now speaking specifically from the lens of a woman, right? Grabbing these opportunities. I know you've really skyrocketed in your career. And have you felt that you've had to say yes to everything? Because if you say no, they won't ask you again?
I think it's a multifaceted answer. At the end of the day, you need to get opportunities, and you get those through sponsors and mentors. And then you need to say yes to the opportunities, and then you need to do a great job. You need to kill it.
Yes.
And at the beginning, I would say you probably should say yes to most things, because quite frankly, as Dr. Tracci mentioned, sometimes things that you don't know if you're interested in, when you start to get involved, you realize that there's a lot of opportunity there, or you can kind of dovetail it with another interest. I think as you move forward in your career and you get a little bit further along and you've sort of more clearly defined where you want to go in the space, then it's okay to start saying no to things that are not aligned with you. But I do think it's our obligation as female vascular surgeons or female surgeons in general, that if you say no, then recommend another woman that could fill your spot. Don't just say, I can't be there. Be like, I can't be there, but so-and-so would do a fantastic job. And that's how you can sort of elevate other women around you and continue to sort of grow our presence in the field.
I love that. I love that. I totally agree, by the way. I'm also a big say yes to everything. As I mentioned earlier, 3 husbands said yes to all of them and then said no. But speaking on that then, Dr. Perri, we were just talking before we started about this idea that, you're a CT surgeon. You mentioned 2 other CT surgeons that I'm also friends and colleagues with. And the idea that all 3 of you are single. So let's talk about that, because is that something that you feel is a problem in the space in terms of our work not allowing us to do what we want to do? Or is that a choice? Like, talk to me a little bit about that.
Sure. So I am a cardiovascular surgeon. I did 5 years of vascular surgery residency, 3 years of cardiothoracic fellowship, a year of super fellowship in aortic surgery, and 6 months of super fellowship in heart-lung transplant. So it's a 9.5-year training paradigm. I presented earlier this week on a telephone survey on 23 surgeons who are boarded in both cardiac and thoracic surgery, and 3 out of those 23 surgeons are women, and those 3 women are not yet married. I wouldn't say it's by choice. I think it takes a lot of hours and dedication to pursue this field. But I would have to agree with Caitlin. When you are a young cardiovascular surgeon, you must always, quote unquote, kill it. So in cardiac surgery, it's about 10% women, and vascular it's about 30 to 40%. So we haven't quite made the strides that they have in vascular surgery. And you need to prove that you have excellent training, that you can do minimally invasive surgery, you can do high-level aortic surgery, and you have excellent, excellent outcomes, because all eyes are on you as a female young cardiovascular surgery. And so the way to really excel is to constantly prove yourself with excellent, excellent outcomes and trying to show up to all of those opportunities, whether they be clinical or academic.
So let me ask you on the back of that then, Dr. Tracci, Dr. Hicks, and you. So I believe this as well, what you all just said. And this idea of like, we have to do well. There's data even in this space, data that like if somebody sends you a patient, whether they are male or female, and you have a bad outcome as a woman, they won't send to you again. Whereas if it's a man, it's different. And we know this is a fact that it's published. So my question to you though is that if you take that combined with the idea that you have to be perfect all the time, does that not make you not scared, but kind of push away from some of the tougher stuff because you're not allowed that grace of failure? How do you guys deal with that element? And you all know I know what I'm talking about. And I'd like to see, Dr. Tracci, you've been in the game much longer than us, like how you dealt with it then, Caitlin, how you're dealing with it now. And, obviously in your case, as you mentioned, different paradigm.
I like finally being around long enough that I'm the old guy on
You're
the
the senior
panel.
one.
So I'd like to pick from pieces of what you just said. I think that you're absolutely right that taking opportunities and doing superlative job is important. I think that establishing yourself as a real vascular surgeon is incredibly important. There is an element of credibility that comes with being clinically active, clinically busy, and clinically excellent. Even more so if you really pick something and become exceptional at it. That said, I absolutely understand, and we've all embraced this idea of killing those opportunities and holding ourselves to that higher standard with an eye to the idea that maybe there's a little bit less of a safety net. There's less wiggle room, less
Right.
room for failure. And I'd like to step away from that view of things just a little bit, because what I see is that is off-putting. It's intimidating. And to the extent that viewing things that way keeps you from stepping into an opportunity that you're not 100% sure how you're going to accomplish, is a negative. I mean, I think one of the things that really has been exceptional in our field is that people are innovators. They dive into things not completely knowing how they're going to solve a problem. And I think we really need to be able to do the same. So I don't think that you can spend all of your time thinking about having to be perfect and to execute on everything. Sometimes you need to just roll up your sleeves and trust the fact that you're hardworking and pretty clever. And you're going to pull this off and give things a try that you may fail at. I mean, look at the guys in Silicon Valley. What do they say? Fail fast? Leave a pile of broken stuff in the corner and move on. There is an element of that we probably need to learn to be a little less fastidious and adopt and be able to move on and learn from things, but not let it weigh us down or stop us from taking opportunities in the future.
I mean, I do think sort of building on that, it's important to remember that vascular surgery or cardiovascular surgery, we're not an island, right? You have colleagues that you can rely on. And so it is never just you have this patient, you must execute and do perfect. You can ask a partner to help you if it's a ridiculously tough case. You can call and get advice from other humans. It is not only on you. It's just that you need to set yourself up for success. And there are certain steps that you can do to make sure that that's more likely to happen than not.
Great. What's your take on that?
And so, similar to vascular surgery, a lot of times in cardiothoracic surgery, we have open options, endovascular options, and hybrid options. And so, it's nice in the modern era, we often have team discussions going over the risk and benefits of each option for the patient. So, you really want to talk to the patient. We have special risk calculators through the Society of Thoracic Surgery for each of our options and offer them what you think would be the safest option for them. But the team approach and also minimally invasive options really does help in terms of patient care.
Excellent. I agree with everything that's been said. And this idea of, being able to not necessarily be perfect, but as good as you can be and recognize that we have it in ourselves to be wonderful. I think that's really important and really key. What you said, Caitlin, is the set of women. I mean, I'm sorry you're at 10%, but more will come. But 30 to 40%. I remember back in the day, they were saying, at the VAM, the table was like one table. And now when you have the women's section, it's like 2, 3. So it's wonderful. Progress is happening. But just let's end with this. What do you think about self-promotion, right? You're at a meeting, you're at VEITH. How important is it to be at these meetings, to be on the podium and to take these opportunities? I know you mentioned you don't have children, but I have them and both of you have kids too, right? So we're away from them. We're moms. how do you take these opportunities, make them part of your life, and how important are they?
I think they're an incredibly important anchor. I mean, I'm a true believer in this era where we've become very flexible and embrace these virtual options. There is an element of being physically present that allows you to actually meet your colleagues face to face, meet people who are going to be collaborators or mentors or sponsors face to face. As you move on in your career and become the old guy on the panel, I guess, you also have the opportunity to wade in and become a mentor and a sponsor to other folks and really kind of pay back some of that. And those are things that I really think that while you may be able to step in virtually and give a can talk, 15 or 20 years into your career, that's a hard opportunity to replicate in your first 5 years, 10 years when you're really building. So I think it's incredibly important. And I think it's important to be, as women in vascular surgery, to be the expert on the panel, not the woman on the panel, but the expert on the panel. And that, I guess, is part of doing an exceptional job with the task at hand and really bringing your best game. I think it's hard to substitute for that.
Right.
I think being at meetings, giving the talks is the excuse to be at the meeting and network with your colleagues, right? And that comes with not just building your brand, but also building future opportunities for collaboration, which is really how you get ahead in this space. You can't do things by yourself. You have to work with teams so that they can recognize what you bring to the table, and you can sort of continue to accelerate yourself and others around you. I think the saying that if you're not at the table, you're on the menu is true. In this case, I think women in vascular, sometimes if you're not at the table, you're just sort of forgotten about.
Right.
So you do need to be present. But I do think sort of worth-like integration, it needs to be considered, right? You can't be gone all the time or else you're going to have nothing left at home to go to. So there are tips and tricks for that, right? You got to be selective in the meetings that you go to. Which ones are you going to be able to meet the connections or network with colleagues? Like the VEITH meeting here, tons of people are present. It's a great use of time. I get so much out of this meeting every year.
Me too.
Smaller meetings, maybe not as much. Or is the meeting in a fun location that you could bring your family with you and they can sort of explore the city? You get to see them, have some dinners, and sort of do a little bit of both. And so I think being a little creative in that space, all the meetings now are way more accepting of having sort of family around in the lobby and receptions and whatnot. It's not a big deal. And sort of hitting that sweet spot for you and probably for everybody, it's a little bit different.
Right.
So I have come to the VEITHsymposium every year since 2013 that they had it. There was just 1 year is canceled because of COVID. 2013, I applied as a med student to the poster competition. I didn't win, but I learned a lot. I met Dr. VEITH and I was encouraged. I came back 2 years later and I won an ISVS presentation award.
Wow.
And the last 3 to 4 years, I've spoken on the podium. It is extraordinarily important to do high quality research and get yourself on the podium. There's a wonderful paper by Misty Humphreys in 2021 on women in vascular surgery, and the percentage of women moderators from 2000 to 2009 was around 10%, and the following 10 years, it was up to 20%. So we've made huge strides, but it's very important not just to excel clinically, but also in research.
I couldn't agree with you more. I think it's a wonderful note to end on. Thank you so much to our panelists, and thank you to VEITH TV.